Hi, I'm Dr. Tanzila Basran and I'm a family and emergency doctor in the GTA. I'm here to talk to you about heavy or long periods. So let's start by talking about some questions that I want you to think about.
The first thing is your period regular? Meaning, does it happen every 21 to 35 days? Now, if your normal is somewhere in between that, that's fine as long as it's consistent every time. But if your period is more than 35 days or under 21 days, that's something to talk to your doctor about.
Again, what's defined as heavy? Heavy is something that I don't want to quantify in numbers because it really depends on you. Something that is affecting your quality of life is probably going to impact you and be clinically significant, as we say it. So if you're going through a pad every 2 to 3 hours on your heaviest days, if you're using a tampon and a pad, if you're leaking overnight or have to wake up in the middle of the night to change a pad, or if you're having clots larger than an inch and really feeling fatigued, tired, and unwell after these periods, that's probably heavy enough for you to see someone. Another thing I want you to know is the length of the period. So a period should last no more than 4 to 8 days, really. If it's lasting more than 7 days to 8 days, you should see your family doctor. So some of the signs of a heavy period actually correlate with some of the signs of iron deficiency anemia. So things where your red blood cells go down. So it could be brittle nails, hair falling out, it could be low mood, it could be feeling tired all the time. And along with some of these signs, it's also the fact that you're just bleeding so much that's impacting your quality of life. So if you're changing the way you're wearing clothes or going to school or work or whatever you're doing on a daily basis, it's probably heavy enough that it's impacting your life. And there are so many safe options to help you, and you shouldn't have to just accept that that's normal. So let's talk about some causes. First and foremost, I want you to watch the other videos in our series because they'll go into them in more detail. However, let's talk about some 3 categories. So one is if your periods are irregular. You may have something such as Pcos, and essentially because you don't release an egg, your uterus does not get the signal and it just builds and builds and builds those layers until you have a heavier bleed the next period. Another cause is bleeding tendency. Again, we have another wonderful talk on this, and essentially this is either genetic or medical causes that make you bleed more. If you're on aspirin, if you're on a blood thinner, or you have some congenital things like von Willebrand's or platelet deficiencies, you might bleed more. And the next one is more structural causes. So this could be things like a polyp, fibroids, adenomyosis, and all these other things that we've also covered in our other talks. All right, so let's say you think that your period is heavy and you want to talk to a family doctor, OBGYN, whoever it may be about it. So if you're coming to me in my clinic, there are 3 things that I'm going to do. 1, we're going to tease out whether your periods are regular, irregular, and how heavy they may be. We also want to find out things through blood work, like I've mentioned. So are there any blood work reasons that make you more easy to bleed? Are you deficient in iron? And that's really important to test. Sometimes we even include hormonal panels like thyroid and other things, depending on what your symptoms really are. Outside of that, we might do a pelvic exam where we assess both with a speculum and do an abdominal exam as well. And again, these things vary depending on your age, your characteristics, and whatnot. And another thing that we often order is an ultrasound. So again, the ultrasound will tell us if there's a structural cause. So is there something that's making you bleed more? And so outside of that, we, it's always a person-to-person variation in terms of what we do exactly, but these 3 things tend to be the first steps. So next, let's come to the main part that everybody's been waiting for. How do we treat this? So again, treatment does depend on the exact cause, but there are things to start off and that work amazingly well. The first thing you can do is your regular over-the-counter ibuprofen or naproxen. So the non-steroidal anti-inflammatories, or NSAIDs class of meds, actually reduce the prostaglandins in your body. And so what it does is it makes your blood vessels shrink and your period is shorter and way less heavier. In fact, some studies show that it's up to 50% less heavy. So how do you do it? You have to take it on day 1, the first sign of a period, even a spotting, you take it. I usually recommend taking it around the clock for at least 2 days. So if it's ibuprofen, that's 400 milligrams every 8 hours, naproxen if it's 375 milligrams every 8 hours, or naproxen 500 milligrams every 12 hours, and those are prescription. Next is something called tranexamic acid. This is known as an antifibrinolytic and basically prevents clots from breaking down, effectively decreasing the bleed. Again, you have to take this on day 1. You find out you have your period, you take it right away, and the dose varies depending on your prescription. The big thing here is, this is a prescription medication, so you should make sure that you don't have any reasons not to take it. So talk to your doctor about it, but they work immensely well and actually can be used along with the NSAIDs that we talked about. And lastly, hormonal options. Now, hormonal options are amazing, but I recognize that not everyone wants hormonal options. If you're someone who's trying to prevent pregnancy right now, it's a great option. Whether it's the pill, the patch, or even an intrauterine device, the IUD, these work so well, and the IUD is probably top in terms of decreasing period bleeding. And so, like I said, there's no one size fits all. However, everyone can always start with the over-the-counter options. But if you have a heavy period and it's impacting your quality of life, please see your doctor, because that's what we're here for. And we always want to make sure that we're, helping you through the process early on.